Hello, everyone. Dr. Nikhil Verma here with another edition of Things I Didn't Learn in Med School. Today, I want to talk about how Congress is destroying our Medicare program and why I believe in the future that physicians will no longer be accepting Medicare if this trend continues, which will put a huge strain on our patients and the elderly who are reliant on the Medicare programs. And I'll start this story based off of I'll start this video based off a story of a patient that came to me and stated that she doesn't understand why when she goes to the hospital and sees a physician that the charges are so much more and why she's paying for the administration and the housekeeping staff and the utility bills of that hospital through her Medicare check and medical claims, and why a physician as myself, an independent physician, is not getting anywhere near that same reimbursements because she was examining her EOBs, the explanation of benefits. We had a long conversation about that, and she's telling me that she wishes there's more independent physicians and that she only wants to go to independent physicians moving forward. Obviously, there's things that you can't get done in the physician's office, but this is the reality of what we're seeing out there. I want to start off by talking about the payments for physicians over the last 23 years. So they did a study from 2001 to 2023, and they were discussing how the price cost adjusted for inflation for the spending of a medical practice to keep open has raised 54% in that time frame. The physician reimbursement has only increased 8% in that same time frame. So not only have our costs gone up, but physicians are really not even been adjusted for the 1 to 3% inflation year to year for the past 20 years. This is a continuous battle. Every year, the Medicare funding gets cut by Congress. And in fact, here recently in 2023, they passed a bill that was going to cut physician reimbursement by 3.37%, which is detrimental to a practice that's trying to keep the lights on. It's detrimental to physicians who are trying to make a living. And if they're losing 3% per claim, that means they have to work harder to make the same amount of money than they did previously. And you can go into the conversation of physicians are rich, they're wealthy, and this and that. But when you look at this data, you start questioning, man, are physicians really getting paid what they deserve, especially with their medical school loans and debts and all the whole 9 yards? It's very challenging. It's very challenging to keep a practice open. It's very challenging to be in medicine when your pay is continuously reduced. Now, thankfully, I say with tongue in cheek, the House of Representatives, Congress had passed a bill recently actually cutting that 3.37% to 1.68%. That's why I say tongue in cheek. It shouldn't happen at all, but we took a 3.3% to 1.68%. We're still getting a cut in payment, and it's not right. You imagine if you're working and instead of your yearly raise or how often you get raise or bonuses, that you actually get reduced payment for the same amount of work. Doesn't make sense to me. It wouldn't happen in any other field. The other thing that comes from this is when this is across the board payment cut from Medicare, it will challenge the other payers, as in insurance companies, and allow them to decrease their reimbursements as well. Medicare sets the standard. Now the leverage point from the insurance companies will come around and decrease the reimbursements for physicians and physician services as well. So that's something to keep in mind of how this is going to affect physicians across the board, not only with Medicare patients. So it brings me to my next point, and this is a post I put on LinkedIn earlier this week about this merit-based incentive payments system, also known as MIPS. It's a Medicare program that connects payments to cost-efficient care and quality. So it makes sense. If you're going to do better work, increase the quality of care for your patients, then sure, get a bonus, get a reward for that. And I think that's agreeable. Some of these things were going a little bit above and beyond what you generally would have in a physician-patient relationship. An extra check of the medications, an extra screening, an extra warning, all these things like smoking and diet and BMI, if you need to have counseling about that, and falls and osteoporosis, like a lot of really good, healthy things to talk about that physicians don't always have the time to talk about given the amount of time, amount of patients they need to be successful. This program was established in 2015, and it was aimed to improve Medicare programs and real-world medical practice, and to reduce administrative burden for physicians. My air quotes will make sense here in a few minutes. The overarching federal program is called the Quality Payment Program to reimburse the physicians. So that's where they would get that bonus money for meeting these certain quality measures. Well, in 2024, just recently, MIPS has decided that it's no longer a reward system. It's a penalized system. So in 2024, if you're not hitting these benchmarks and you get examined by Medicare and the government, you may get hit with a 9% decrease in reimbursement. 9%. And this is on top of all that other percentage that I've talked about, that 1.6 to 8%. This also includes still an increase in inflation of cost of goods and patient care without physician reimbursement going up. Now, I don't know how hard or difficult or what kind of work it takes to meet these quality measures. I'm guessing it's not terribly difficult, but the concept is still baffling to me. What once was based on a reward system is now a penalized system. That doesn't seem very fair. That doesn't seem very right. And I guess just imagine if this was you, what would you do and how would you react if you were getting cut payments for something that you know is right to do, but it doesn't reduce administrative burden. If anything, you're adding administrative burden at this time. So you might have to hire someone to take a look and make sure you're hitting these quality measures. In fact, I got an email about a company that wants to make sure we're hitting our MIPS so we don't get penalized. I would have to pay this company to go back and look. So you can see how this is very detrimental to the Medicare program. I don't see, if this continues, how physicians will continue to take on Medicare patients. It won't make financial sense, and it won't make financial sense for them to maybe even take insurances altogether. So it's something just to keep in mind. It's something I want people to be aware about what's going on, and this is why it's important for the physician advocacy groups and a lot of the lobbying that we're trying to get together and push this in front of Congress and let them know what is happening and why the quality of care is going down of healthcare in America and why some of the elderly patients may not get the care that they need in the long run. This is why I'm moving more to a self-pay, cash pay model and really want to help patients work one-on-one with them, try to help them so they can stay out of the hospital systems. And this can be much cheaper because the average deductible is around $5,000, give or take. Some people paying $8,000 to $12,000 for a full family. That's a lot of money for a deductible. Some of these programs as far as like a direct primary care program can be as inexpensive as $2,000 a year. And you're getting all the blood work, all the checkups, and all that stuff without having to hit the deductible. Now, of course, if there's catastrophic care or there's some big imaging or studies that you need, of course, you may want to use part of your deductible for that. But at this point, it just makes sense to kind of stop looking and relying on the insurance company and Medicare. So with that being said, if you or someone you know wants to work with me one-on-one, I'm happy to see if I can help out. Send me a message, drop me a line, and we'll see if I'm a good fit for you. And if not, please drop a message, subscribe, follow, like, and share this video. And let's get the message out there. Let's get together. Let's have physicians start working together instead of against one another to make this fix in healthcare. And for patients out there, at this moment, it's time to take healthcare back in your own hands, and your own health matters. And I'm here to help. So I hope you found this useful. I hope you share this and like it. And if you have any questions, please drop below, and we'll talk to you soon.